From the steamy jungle that is South Florida, a mysterious stranger known as Dr. Bones cries out in the wilderness.
Ah! 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 Oh!
This is the hour of doom
and bloom.
That's right, friends and neighbors. Welcome to Doom and Bloom Survival Medicine Podcast, a castle of consciousness in a crazy world. And the #1 show about medical preparedness, mostly because it's the only show about medical preparedness on the interweb. And who am I? I am Joe Alton, MD, that old Dr. Bones of the award-winning survival website doomandbloom.net. And off-screen is my wonderful co-host, Nurse Amy, nurse practitioner extraordinaire and beauteous purveyor of quality medical kits at store.doomandbloom.net. And why is she off-screen? Heck if I know. She's the one who's easy on the eyes. Well, why are you off-screen? What's going on here?
Because it takes too long to do hair and makeup.
Well, I mean, I did my hair and, well, I don't know if I did makeup.
No, you didn't do makeup.
No makeup.
But your hair takes you 2 seconds.
Oh.
Guys are so lucky. They're like, oh, where's the brush? Okay,
Lucky
so-
guys. Us lucky guys.
Yes,
Well,
you're lucky.
I'm lucky because I have you, honey.
Aw, you're a sweetheart.
On this show, you're going to get the conventional medical wisdom, the unconventional medical wisdom, plus absolutely free, the unhinged vocalizations from a man that Joe Biden regularly beats when they play the Jeopardy home game. But hey, whatever it takes to get your family medically prepared for times of trouble, you're going to hear it right here. But first, you got to listen to this. All information and opinions voiced on the Survival Medicine Podcast are for entertainment purposes only and do not represent medical advice for anything other than post-apocalyptic settings. We strongly urge our audience to seek modern and standard medical care whenever and wherever it is available. Or don't, if the world seems just peachy keen to you. But answer me this, who's going to keep your family safe and healthy when times get tough, when the hospitals are out of commission, when the doctors are long gone, and someone you care about is sick or injured? Well, don't look at me. I'm just a dog-faced pony soldier. It's you, old buddy, old pal. You and I both know when it's least expected, you're going to be elected. So get off your duff and learn some stuff, and why not get some medical supplies while you're at it? I'll bet Amy can tell you where you can find some.
Absolutely. Store.doomandbloom.net. You can also just type in altonfirstaid.com.
That's
It'll
right.
Take you to the store.
There you go. I want to mention that the Book Excellence Award-winning 4th edition of the Survival Medicine Handbook ranks a whopping 4.8 out of 5 on Amazon. That's over more than 3,500 reviews and still tops bestseller lists in medical categories throughout the country. If you haven't checked it out yet, you'll find the black and white version on Amazon and the color version at store.doomandbloom.net. We even have a color spiral-bound version on our website. Okay, so this is the deal. Why are things looking different here? Well, we are retooling the podcast. Blog Talk Radio is now out of business, and so we had to make some changes. And also, I'm old, and I'm getting a little senile, so to keep me awake, I'm adding some interesting news, may have something to do with survival medicine, may not, you never know. And why? Well, just because, let's face it, you reach a certain age, and you just do what you want to do. And that is my prerogative. I'll keep the politics down to a minimum, and there's enough weird stuff going on out there to talk about. And so we're going to find some stories that are interesting for you. So this is how it's going to go. Start off with some stories, and later talk about some medical topic that's pertinent off the grid like I did before. I can do it the other way around, medical stuff first and then news stories. Let me know what you think works better. I just know that some of the medical stuff is sort of boring, important, but boring for some people. So just go to about midpoint if you're only interested in the medical stuff. Just know this is a work in progress, but hopefully more interesting for you and for me. And that's going to be, you know what? Win-win. Win-win-win-win-win.
And now, a word from our sponsor.
Hey, are you taking freeze-dried fruits and vegetables but annoyed at the inconvenience of having to eat meat? Well, here's Unbalanced Meature. We've taken all those whales that the wind farms are killing, plus all those silly ducks and chickens that had a little case of the flu, and ground them up into pellets that give you a full portion of meat every day, along with an additional bonus, 3,000,000% of the daily recommended dosage of blubber and chicken beaks. With your introductory 55-gallon drum of meat pellets, you'll have a whale of a time impressing your friends with how long you can hold your breath underwater. And you might even grow feathers. Unbalanced meature. You'll never have to, or be able to, eat real food ever again. You know, it's important to realize that there are infections that are rarely reported in normal times that may become major issues if a disaster throws you off the grid. The family medics has got to be aware of what disease-causing organisms exist in their area, even if they're rare today. Now, let's talk about parasitic worms. Wow, parasitic worms, that seems crazy. It's something you certainly don't see in normal times in first world countries. Off the grid after a disaster, however, well, maybe not so unusual. The word parasite comes from the Greek word parastos, someone that eats at someone else's table. Now, I think if we had to choose a parasite we would at least want in our body, most would pick, I guess, the alien from the movies, but in real life, maybe it's worms. Parasites like ticks, fleas, mites, leeches, and lice, they live on our skin, or just beneath, and these are called ectoparasites. Worms, they're known as helminths or endoparasites. They live deep in our intestines or other core organs, often gaining sustenance by sharing our partly digested food. They're also egg-laying machines, with some depositing tens of thousands a day into their host. Wow. Types of worms include nematodes, trematodes, flatworms, flukes, and others. The diseases that these multicellular organisms cause are serious health issues in underdeveloped countries due to difficulties with sanitation. But even in developed countries, any disaster that impairs access to safe food and water can cause cases of parasitic worms to skyrocket. Worm infection is initially caused by accidentally ingesting soil that contains their eggs. While the ingestion of soil may seem like a pretty rare occurrence to you, there are many areas that exist where people defecate openly and fail to wash their hands. This leads to contamination in the soil that ends up on people's hands and ultimately their mouths. Even failing to wash the food you grow in your gardens, that could be a thing. Parasitic worms range widely in size, and the longest tapeworm, for example, that was ever found in a human body measured 82 feet long. 82 feet! That's incredible. The most common helminthic infection we see in the U.S., however, is the tiny pinworm, which affects 40 million Americans. Almost a quarter of the world's population has some type of worm infection. Children are especially vulnerable and may experience stunted growth and developmental problems as a consequence. Worm eggs or larvae enter the body through the mouth. They could enter the body through the nose. They can enter the body through breaks in the skin. They could enter through the anus. Amazingly, many helminths actually require the stomach acid that kills many other organisms to dissolve their eggshells and allow them to hatch. Now, once they're hatched, the acid-immune larvae travel through the stomach and attach themselves to the walls of the intestinal tract. I guess I should say travel from the stomach. They don't actually dig through the walls of the stomach and go through the walls of the intestinal tract. The intestines aren't the only things affected in many cases, though. Some species infect the liver and maybe the lungs. Colonization by worms may be a total surprise to the person that's actually infected. I mean, it could be totally asymptomatic, in other words, not feeling anything. But in some cases, like pinworms, they can cause symptoms that drive you nuts, like itching in the anal area. With some species, however, a large concentration of worms can cause much more serious, even life-threatening problems to occur. Now, each type of worm causes different symptoms, but you have to suspect their presence if you have an unexplained case of constipation or diarrhea, abdominal swelling, abdominal cramping and gas, constant urge to have a bowel movement, that's something that you might see, nausea and vomiting, weight loss, unexplained skin rashes or sores, anal itching, as I mentioned, difficulty sleeping, constant fatigue, chronic muscle and joint ache, and malnutrition. In rare cases, the population of internal parasites is so high that it causes an obstruction of the bowel. It can also cause respiratory distress or a weakened metabolism. Although your body sets up an immune response against the worm, it's unlikely to kill the invader. Now, I'm not trying to scare you. Death isn't the most common result of a worm infection, but all the energy put into defense against it weakens the ability to fight other opportunistic infections from, let's say, bacteria or viruses. Some worms actually compete with your body for the food that you take in. A species known as Ascaris, for example, will attach to the wall of your intestine and eat partially digested food that comes its way. This competition prevents you from absorbing nutrients effectively and may cause anemia, a low red blood cell count, and malnutrition as an end result. Let's talk about the types of worms. There are numerous types of worm-type infections or helminthic infections that are based on the species involved. Worm infections you use instead of the word itis, I-T-I-S, which means inflammation of an organ, let's say, like appendicitis, you use the suffix asis, A-S-I-S, to the worm species that's involved. So ascariasis would be an infection with the worm Ascaris. Although there are many worms that infect humans, some of the most common types are pinworms, which we mentioned before. These are a type of nematode called a roundworm. Reaching only about 1/3 of an inch in length, they lay eggs around the host's anus, usually at night. And this leads to an itching sensation which can become pretty severe. Pinworms are the most common parasitic worm infection in the U.S. I think I mentioned that already. A cycle then develops where contaminated fingers from scratching come in contact with the mouth. This transports the eggs inside the body where they hatch and start the cycle all over again. Now you can easily test for pinworms simply by placing some adhesive tape in the anal region of the patient. This is best done when the patient wakes up in the morning. Inspect the tape for worm eggs, and they can be seen probably with a very low power microscope, maybe even a magnifying glass if you had a strong enough one. Symptoms may be somewhat different based on a person's sex. Both males and females will have anal itching, but young girls may also have more discomfort than itching if the pinworms crawl into the vaginal or urethral area. Then there are hookworms. Hookworms are another kind of roundworm, and they're one of the most common helminth infections worldwide. The parasite feeds on blood from vessels in the intestinal walls. Hookworm infection is sometimes asymptomatic, but it can cause anemia as well as abdominal symptoms. Occasionally, a larval or juvenile hookworm that uses a non-human host can penetrate the skin of a human. Now, although it can't go into the organs, it can cause a skin disease called larva migrans, once known as creeping eruption. You can see S-shaped vein-like lesions on the skin with itching. As the larvae move, areas where they previously were may become crusty and also continue to be itchy. Then there's Ascaris. That's the largest intestinal roundworm, and it reaches up to 14 inches in length. And it's thought there are up to 1 billion people that carry this worm, and most of these people are, as you can imagine, in poorly developed countries. Ascaris eggs, when ingested, become larvae that enter the bloodstream through the small intestine. When they reach the lung, Ascaris larvae leave the circulation, are eventually coughed up, swallowed, and return to the intestine where they mature. The adult female worm can produce up to 200,000 eggs a day. Wow! Ascaris effects may include bloody phlegm, fever, cough, and abdominal symptoms. If the concentration of worms is high enough, they actually may begin to leave the body through the anus, nose, or mouth. This is I've seen pictures of this. This is pretty incredible, absolutely revolting, honestly. Then there are tapeworms. Everybody's heard of tapeworms. It's a type of infection caused by a flatworm that lives mostly in Asia or Africa. The worm is indeed flat. When ingested, tapeworm eggs can form walled-off cysts in organs, causing damage to certain body tissues. If larvae are ingested, however, they'll mature into adult tapeworms in the intestines. The adults are sort of segmented, and they reach pretty impressive lengths, 82 feet. The one I mentioned earlier, that's the record. Symptoms are typical for other helminth infections, but the infected organ may also malfunction. Medications that can kill parasitic worms are called vermicides. All of these are prescription drugs, although persons with travel plans to underdeveloped countries really shouldn't have trouble getting these from their physician. One of them is albendazole, and that's also known as albenza. Roundworms, hookworms, tapeworms, larva migrans, and pinworms can all be treated with this. You would take 400 milligrams twice a day if your weight is 60 kilograms or more. Duration of the therapy varies widely with the species. There's mebendazole, that's called Vermox. That's most specific for pinworm, but that'll treat hookworm, roundworm, or whipworm. You would take 100 milligrams once for pinworm and 100 milligrams twice a day for 3 days for other species. Then there's praziquantel. You might have heard of this, biltricide. This is used for tapeworms. It's also used in dogs. And you would use 20 milligrams per kilogram of body weight 3 times a day for just one day. You take the doses at intervals of not less than 4 hours and not more than 6 hours. Then there's pyrantel. That's pyrantel pamoate, and that's good for roundworms and pinworms. You take 11 milligrams per kilogram once, but some species you may need to take it daily, 1 time a day, for 3 days. 1 gram maximum dose. It can be used in pregnancy, by the way, if benefits outweigh the risk. And then there is, guess what? Surprise, surprise, ivermectin. Ivermectin, also known as strometrol, is good for roundworms. You take 0.2 milligrams per kilogram orally once, and it's also used for treating things like scabies, and it has been researched as a possible COVID-19 therapy. And indeed, it's a favorite medicine that the COVID Critical Care Alliance recommends on its website. It's important to know that dosing may vary with some of these medicines, it's depending on the type of worm, and that a second course of therapy is not unusual, and you administer it if the patient is not cured in a couple of weeks, 2 to 4 weeks, let's say. It should be noted that the bitter taste of some of these medicines may induce vomiting if you don't swallow them quickly. Most of these medicines, by the way, aren't used in children under 2 years of age or pregnant women. As pinworms are the most common helminth infection in the U.S., there are some additional strategies that are worth mentioning. Over-the-counter medications are actually easy to obtain for your medical storage for pinworms, but they're usually in liquid form and do lose potency over time. Examples are Reese's, like Reese's Pieces, Reese's pinworm treatment, sort of a banana-flavored liquid, and then there's also Cara, C-A-R-A, Pinaway pinworm treatment, that's sort of a caramel-flavored liquid. Both of the medications contain pyrantyl pamoate as the active ingredient. They're safe for children 2 years old and up. Follow the directions for weight and dosage carefully, though. Sometimes pinworms can be removed from sensitive areas with a cotton tip applicator covered with petroleum jelly. It's not a cure, however. Now, when you make a diagnosis of worms, you got to follow certain steps. We have to wash all bed linens, towels, and washcloths used by the patient with hot water and a detergent upon diagnosis and then regularly afterwards. You want to make sure you don't shake out clothes, bed linens, or towels inside the house to prevent spread. You want to clean all surfaces of sleeping quarters, including floors, daily. Clean all bathrooms daily. Bathe the patient and change their clothes daily. And keep their fingernails short because scratching near the anus can lead to fecal-oral transmission. It also can lead to infections in that area. There are plants that discourage worms, and they may be another option off the grid. Garlic, ingested fresh and raw, is thought to be an effective way to eliminate worms. Wormwood, clove, papaya, pineapple, cinnamon, turmeric, black walnut tincture, plumeria, these have all been reported to be helpful. Interestingly, some people believe that tobacco may help eliminate worms. Careful attention to hygiene, wearing shoes when outside, and among medical providers, strict glove use will decrease the likelihood of passing worms or their eggs from person to person. Hand washing, especially before preparing food, is considered especially important in preventing community-wide outbreaks. On the grid, you may never actually encounter somebody with worms, but off the grid, not so surprising, so it's important to have the knowledge. This portion of our program is sponsored by the Talking Dogs podcast. Join Gizmo and Slobbers, two golden retrievers from the future who, thanks to special brain implants, can talk and discuss issues that concern canines of all stripes in today's cat-centric world. Left by accident in the T-4000 time machine while their owner was buying space cigarettes, Gizmo and Slobbers spend their day discussing important questions like, who's a good dog? Who wants to go for a walk? And who's my favorite little buddy? Plus, timely topics like squirrels, evil geniuses, or just evil. Are they worse than ducks? Get your morning woof on with Gizmo and Slobbers. You'll be glad you did. Available on all super futuristic streaming platforms in the fifth dimension. And we're back. The number of measles cases linked to an outbreak in western Texas has grown to 90, according to data released recently by the CDC. 77 of the affected individuals are less than 18 years of age, and 1 in 6 are requiring hospitalization. New Mexico and several other states have reported cases as well. So what is measles? Measles is a contagious virus disease, also known as rubeola. It was once so common it was considered a childhood rite of passage. You couldn't get through childhood without getting it. It shouldn't be confused with rubella, which is German measles, that's a different virus altogether, or roseola, a milder viral illness also seen in childhood. The disease was almost eradicated in the U.S. in the 2000s, but it's been experiencing a resurgence in the last few years, and in long-term survival settings, gosh, we can expect it to be even more common. So the signs and symptoms of measles, we've got to talk about that. Physicians have seen so few cases of measles in the recent past that few doctors have ever even treated a case. State health departments have had to send out flyers alerting them to the signs and symptoms of the disease. Measles patients usually start off with a high fever, often reaching 104 degrees Fahrenheit. Wow. 2 to 3 days later, A red patchy rash appears, usually starting on the head and face, then working its way down the rest of the body. It develops so many spots that they coalesce into even bigger blotches as time passes. Other symptoms often resemble respiratory and eye problems, and you may see what we call the 3 C's of measles. The C's are cough, coryza, which is the medical speak for head cold symptoms like nasal congestion, etc., and conjunctivitis or pink eye. Many people often manifest white spots on the inside of the mouth, and we call those Koplik spots, and those are seen in people with pretty severe cases of measles. Other issues that are seen in more severe cases include diarrhea, 1 in 10 cases, pneumonia, 1 in 20 cases, that's the most common cause of death in children, ear infections in 1 in 10 cases, occasionally leading to permanent hearing impairment, corneal scars affecting the covering of the colored part of the eye, and that's something that can affect your vision long term. Brain inflammation and swelling, that occurs in 1 in 1,000 cases, occasionally resulting in the death of the patient or permanent damage, and convulsions, which you see as a result of the high fevers, especially in children. All these signs seem to occur more often either in children under 5 years of age or adults. Pregnant women with measles may deliver prematurely or have low birth weight infants, and death is about 1 in 1,000 cases, especially if you get the brain inflammation. How contagious is measles? If you followed my blog, you may remember the R0 number, the RO number, that we discussed during the COVID pandemic. The R0, or reproduction number, is a 100-year-old brainchild of a public health expert in demographics named Alfred Lotka. A disease's RO, he said, is the number of cases that will occur in a population if an infected person is placed in the middle of it. Not just any population, however, one that hasn't been exposed to the infection in the past. In the 1950s, epidemiologist George MacDonald used it to describe the contagious potential of malaria. He suggested that if the R0 number is less than 1, the infected person will transmit to less than one other person, and the outbreak will eventually peter out. On the other hand, if the R0 is greater than 1, the disease will spread. Seasonal flu carries an R0 of about 1.28. Measles, however, because of its airborne nature, it's thought to be 12 to 18. That means each person with measles would, on average, infect 12 to 18 other people in a totally susceptible population. Wow. You may transmit the disease if infected for several days, by the way, before the first symptom, and you may continue to be contagious for several days after recovery. Let's talk about measles and vaccination. A sore subject for many, and I'm not talking about just the jab. The measles vaccine has been available since 1963 in the United States. Before vaccination became a standard recommendation, there were actually hundreds of thousands of cases and several hundred deaths expected on a yearly basis in our country. After its institution, though, the number of cases dropped precipitously. Health officials have been urging anyone who isn't vaccinated to receive the measles, mumps, rubella, or MMR combo shot. The Centers for Disease Control and Prevention currently recommends people receive 2 vaccine doses, the first at age 12 to 15 months, and the second between 4 and 6 years. 1 dose is 93% effective, and 2 doses is 97% effective against the 3 diseases. These protection rates are some of the best for any vaccine, by the way. Only the tetanus and smallpox vaccines approach this level of success. Concern about vaccine safety, however, that's a real issue for many Americans. For the many that are concerned, a standalone vaccine for measles as opposed to the MMR combo might seem to make sense. Unfortunately, unlike some other countries, a standalone vaccine is not available in the United States. And there are risks to vaccination. Many vaccines, including the one for measles, have side effects that are seen in a percentage of patients. The most common are fever, rashes, and cold-like symptoms, and in the case of measles vaccine, these occur in about 5 to 14 cases out of 100. More serious complications are much rarer, but may include bruises, confusion and irritability, vision changes, swelling of glands, headaches, stiff neck, nausea and vomiting, and pain, redness, or swelling at the site of injection. In normal times, people experiencing the above after receiving a vaccination should be evaluated by their physician, as there may be signs of a complication. The decision regarding vaccination should be based on hard data with the backing of science. Now, although vaccinations can have their risks, the positives do outweigh the risks when it comes to the measles vaccine. It should be noted, however, that all vaccines are not created equal. You've got to do your own research and come to a conclusion that will best protect your family. Measles is a serious disease that's making a comeback. Be aware of the signs and symptoms and consider your strategy for dealing with any infectious disease in times of trouble.
This show is sponsored by possums. Possums, those beautiful marsupials who you'd think would spell their name starting with a P, but it's really an O. Get one for your home and get some real use out of those rabies shots you keep in that old refrigerator in the woodshed. Oh, possum.
Hi, Joe Alton, MD here, also known as Dr. Bones of the survival website doomandbloom.net, co-author of the Book Excellence Award-winning 4th edition of the Survival Medicine Handbook, and designer of quality medical kits at store.doomandbloom.net. This week we have a question from CJ, who writes, are there any immunizations or medical procedures I should get done here in the States before going on a multi-month backpacking trip to Southeast Asia? Here's the details. I'm not a big fan of jabby jabs, but try to be pragmatic. I'll be staying at hostels, campgrounds, and hotels in Thailand, Laos, and Burma. I think Burma is called Myanmar now. While visiting their mountains, rainforests, and beaches. Wow, nice. With 2 months to go, I'm all caught up on dental work and have my yearly physical scheduled for 2 weeks before departure. I'm just wondering if you can advise anything on the medical side to bring up to my MD. Thanks so much. Wow, CJ, what an adventure. Asia has many beautiful and interesting areas to visit, and it's going to be certainly a memorable experience, but there are a number of endemic diseases for which you have to watch out. An endemic disease is one that's habitually seen in a particular region. Vaccines are a touchy subject these days, for sure, but there are certainly risks of disease transmission in the type of long-term trip to exotic places that you're contemplating. Your doctor will most likely follow CDC recommendations, which are guidelines for what routine vaccinations they feel you should have had in the past, and what special vaccinations are given for those traveling to where you're going. It'll be somewhat similar to what happens when you enter the military. The CDC recommends the following vaccinations for travelers to East and Southeast Asia: hepatitis A, hepatitis B, typhoid, cholera, yellow fever, Japanese encephalitis, rabies, and polio. I see they don't mention malaria, which also might be common. Equally recommended options for malaria prevention include chloroquine, atovaquone or progranil, doxycycline for adults, and mefloquine. Primaquine is used in areas where there's a particular type of malarial organism known as Plasmodium vivax. So research into that. It's possible you may have had one or the other of these immunizations in the past. If so, ask your doctor if they recommend a booster. Additionally, the list of routine vaccines given to most Americans includes measles, mumps, and rubella, tetanus, diphtheria and pertussis, influenza, chickenpox, shingles if you're a certain age, pneumococcal pneumonia also if you're in a certain age, and meningitis. Then, of course, there's COVID and respiratory syncytial virus, which form, along with influenza, the tridemic of respiratory diseases that we've seen seasonally in the last few years. That's a lot of jabs, so make sure you do your own research and come to your own conclusions. Vaccines are usually safe, but a percentage of people will have problems. I know about this personally, so know what you're getting into. Given that you're backpacking, it suggests that you might be in the backcountry where food preparation and water disinfection might be iffy. The cities, which will be crowded, might not be much better, however, and exposes you to many more people that can transmit diseases. Consider asking your doctor for a course of antibiotic, or maybe 2 to take with you, just in case. Say something like doxycycline. You never know when it'll come in handy. Flagyl is another good option. CJ, I wish you a safe and healthy journey. I'll tell you, I'm an old man now, and I no longer have the desire nor the ability to hit the road to new and strange lands. I can only say that after this trip, you'll never have to prove your courage in any other way. I admire you for it, and best of luck. This is Joe Alton, MD, that old Dr. Bones, wishing you the best of health in good times or bad. Thanks for listening. Hey, learn about more than 200 off-grid medical topics in the award-winning 4th edition of the Survival Medicine Handbook, and get your family medically prepared with quality kits and individual supplies from our entire line at store.doomandbloom.net. You'll be glad you did. Well, that's all the time we have for today. I hope you enjoyed this episode of the Survival Medicine Podcast with Dr. Joe Alton and Nurse Amy Alton. Have a good one.
You've been listening to the Doom and Bloom Hour with medical preparedness experts Dr. Bones and Nurse Amy. Check out our website at www.doomandbloom.net for hundreds of informative articles about survival medicine, gardening, natural remedies, medical supplies, and lots of other good stuff. contact us, send your email to drbonespodcast@aol.com or use the contact form on the main page of the website. See you next week.
Are you worried about how dangerous the world has become? In these days of terrorist attacks, natural disasters, or even a future collapse, you need to be medically prepared to keep your family safe. I'm Amy Alton, ARNP of store.doomandbloom.net, where you'll find an entire line of uniquely designed medical kits and supplies for when help is not on the way. For everything from individual first aid kits to the ultimate family bag, go to store.doomandbloom.net today. You'll be glad you did.